Hey, good morning. I thought this might be the easiest way to discuss this case with our schedules. This is a patient who referred to me for congenitally missing 7 and 10. I have subsequently grafted the buccal of both of these and improved the soft tissue profile, and he has healing abutments on both of those implants. Um, Clinically speaking, I did this guided. Although this looks from this angle like they're massively palatable, if you really look, I've given you the ability to try to make these screw retained. With his overall oral hygiene, although dramatically improved after multiple conversations with him through the follow-up period, I'm just was concerned about retrievability of these, so I definitely did not want you to have to do cement retained if we could avoid it. But back to what I'm calling you about, he wants teeth down here in the anterior mandible. I don't believe you referred him to me for that. No, I just double checked. You actually originally referred him just for number 7 back on October 7th of 2025. Then we had reached out to you about 5 months later. We got a referral for number 10 as well. So I think we communicated about it. He wanted both of those teeth repaired and replaced. And so now we're about 3 months, I believe, from clearing those torque tests and x-rays to verify that you can restore 7 and 10. But again, the reason he is presenting is for this severe atrophy in a dentulous space in the anterior mandible. What I need to know from you is, are you going to be comfortable with me placing these implants, 2 implants in the anterior mandible, relatively deep, leaving you approximately 15 to 17 millimeters of restorative space? This would be like a little FPD with custom abutments on 2 implants supporting 4 teeth. Typically, when I do that, I'm not getting these implants really close to the canines because we can cause an iatrogenic bone loss trying to tuck these implants that close. So I will place the implants likely about in the embrasure of the lateral and central on both sides. And then with custom abutments, hopefully you can do a cement retained bridge down in that area. They'll need to be pink porcelain to make up for some of the vertical height. I've got the case going in Blue Sky Bio right now. When you drop implants in there, they have to be linked to implants. So when I deleted the implants, it deleted the teeth, and it just didn't give a good representation. So I do think there is space to get him teeth. They may look a little bit narrower, but that's something you can handle with the lab. Looking at his plan in Blue Sky Bio, you can see he's very, very narrow at the superior aspect of the ridge. But the bone gets wider, and I can place a fairly long implant. Um, Again, with this being cement retained, I'm probably going to be focused on just keeping the implants as parallel as I can to one another. But then the angulation AP is just going to be based on where I can get this implant best in bone. So the other thing is I've got some challenges with my guide. The deeper I go, the guide tube's not going to work. So I can work those and navigate that. And then custom abutments can make up for a lot of the discrepancies within just the angulations in general. But that gives you some visual of kind of how the bone looks in there. And then ultimately, this is kind of what we're dealing with here. See how the spacing, I don't have those implants right up against the canines, but be able to get him an FPD down there. Please let me know so that we can get him scheduled. He also is going to need costs from you on what a 4-unit prosthesis would look like that in the anterior mandible. We provided him cost for local 2 implants, surgical guide, healing abutments for this. We did talk about grafting a little bit. I don't know if grafting is going to change this significantly. By placing these implants where I'm placing them, he would also be a candidate to use these as an overdenture in the future because there'll be adequate restorative space. Could even be converted to a full arch case if he were to lose all of these teeth. He just need 2 more implants, and it could be a lower hybrid because we'd have adequate restorative space. So please let me know. Hope you're doing well. Have a great weekend.